nurse talking to some of the fathers, it can become an issue. And then sometimes there are just cultural beliefs where some cultures don't believe that women should be so active in the workforce, and so that becomes an issue. But it's something that we don't experience as often now, but you do see it.
Do you think age has an impact on your job communication? If so, how?
It did in the beginning, I think. I look young, or I did it really in the beginning.
You still look young.
Thanks. But people would be like, oh my gosh, you're my child's nurse, because I look so young. And so I think they didn't expect for me to be as knowledgeable. You know, even though I've been to school, it was kind of hard for them to understand. And now that I've been there, I have that confidence. And it's gotten better over the years that I walk in differently than nervous and all that, like I was in the beginning. So I think that helps. But I think it did in the beginning. I think age was a big factor, but not so much anymore.
That's good. What role do nonverbal communication cues play in your work environment? And how did you learn how to interpret these?
I think it's huge where I work, just for the fact that, you learn to read off of, the family members. You can tell by the looks on their face. Are they comfortable with what's going on? Do they understand? Are they nervous? Are they upset? And which is a big thing you want to pay attention to in ICU, because you want to make sure that they're comfortable and that they have all the confidence in you. And then also you have to be really careful of your own nonverbal cues. If you're in the room and the kid is crashing, you don't want to look nervous, and you don't want to let the parents know how alarmed you are, because you don't want them to panic and freak out. So as far as learning to interpret all of that, it's just life. It's being there. In the beginning, it's like anything, you learn as you go, and so you just get better and better at it.
Oh yeah, definitely. And do you have any final thoughts or any advice to give me before I head off into trying to go to nursing school and everything?
I would definitely say find something within the field that you love, that you will want to be in and do for a while. A lot of people, ICU itself, people don't stay a long time. It's hard. It's really hard to see everything that we see, but it's rewarding at the same time, which is what keeps me there. But I think one of the hardest things that I see is when a nurse has been there too long and they become apathetic. And if you don't care, then you don't need to be there. So go somewhere that you're going to love and that you'll love for a while, and that will make you happy every day. Because it's hard to go to work when you see some of the stuff you do, but if you love what you're doing, then it makes it worth it.
Yeah, I definitely agree that people should be happy where they work.
Yes.
Well, thank you so much, Angela. It was a pleasure doing an interview with you.